Hello, I'm Marjorie Dean. I am a practical nursing instructor here at MCC, and for this demonstration I'm going to demonstrate hand washing. Now, hand hygiene encompasses a lot of different things, not just hand washing. Hand hygiene is going to be the antiseptics we use, surgical scrub. There's a lot of different things that go in that. So in hand washing, this is just a basic hand washing step for you to do, and you will actually do this with a partner and check each other off on that. We'll give you a sheet that you can follow along and make sure that all the steps are followed. One of the first things it says is determine the length of time needed for hand washing according to task at hand or degree of soiling and contamination. Well, for the most part, you're looking at 20 to 30 seconds of hand washing to be good enough between patient care, after you've done a task that there were soiled items involved. So you need to consider 20 to 30 seconds of hand washing. There is one condition that you cannot use antiseptic on at all, and that is if a patient is diagnosed with C. diff. And we'll get into more of that as we go along later. You have to use soap and water. And CDC says that for every 5th time you have used alcohol-based rub, you should go to the sink for hand washing with soap and water. Now, who is counting every 5th time? I don't know. So the best thing is every time you go in a patient's room to wash your hands. And then in between, you might want to hit the hand sanitizer. Okay, so right off the bat, it will tell you to make sure and look at your environment. We've got paper towels. We've got a soap dispenser. We have a sink that has hot and cold running water. And it tells you to take your jewelry off. When we go to clinical, you will not wear anything other than a wedding band. So what I'll do is I'll take everything off. Your watch may even get in the way as well. So for this skill, let's go ahead and take your watch off. Okay? So it will tell you to adjust the temperature. Of course, the longer it runs, the hotter it's going to get. In this sink, what is going to be the areas you do not want to touch once you start washing your hands is actually the handles, the faucet, the sink itself. So you want to stand away from it, okay? So we've adjusted the water, it's a little hot. Okay, so we're going to get enough soap that I can make a lather. And I'm just lathering up. Okay. So you're going to want to wash the palms of your hand. And you can count 10 times to yourself. Okay. Then it's going to tell you to wash the back of your hands. Each one. Then it's going to tell you to interlace your fingers. Now there may be a little variation. I'll have to look at your paper. Some people will take their fingernails and put it in their palm. Your paper may not say that, but that's fine. We're getting the general principles down, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Some places want you to get an orange stick to actually clean under your fingernails. It depends on where you work. Your wrist should be the last thing you do. 10. Then you're going to rinse with your fingers down and not touching anything. Making sure that you get all of your soap off. So at this point, if you're thinking clean to dirty, the cleanest part is going to be your fingertips. The dirty part is going to be what you have not washed. Okay? So you're going to want to take a paper towel and wipe up. Okay? Another paper towel, wipe up. And then the last paper towel, you'll want to take and cut the sink off. It talks about putting lotion on your hands if you need to, and the purpose in that is the more you wash your hands, the more likely they're to get chapped, chafed, or cracked. And you don't want to cause a skin area that could get contaminated with infection. A lot of the soaps have some type of lotion in them. So that's why you lotion your hands after you actually do your hand washing. And once you start this procedure, if you have questions, we'll be glad to help. Thank you.